technology. If this is the hardest thing that Dr. Penn does today, I think we're in a good position. So I'm Dr. Jaime Seeman, a board certified obstetrician and gynecologist. This is Dr. Robert Penn, and I'll let you introduce yourself and give your background. You're the expert here, I think.
Okay, thanks, Jamie. I'm an infectious disease specialist and healthcare epidemiologist here at the Methodist Hospital here in Omaha, Nebraska.
Yeah, so we're dealing with COVID-19 right now, and we thought this would be a great opportunity to jump on and talk to the people in the community. We are going to have people tuning in actually from across the country, and we do have COVID-19 right here in our community, and Dr. Penn is on the front lines of treating it. So I think it would be great to just kind of get your opinion of what are you seeing right now in the community? What are the presenting symptoms that really people should be watching for?
Well, Jamie, since we saw the first patient here in Nebraska going back to the first week in March, I should add we were really preparing since January. I had brought it to our attention to our infection prevention control department that there was this unusual outbreak evolving in China. And initially it was an unknown type of infection. And then it evolved that they identified the virus earlier in January as a coronavirus and brought that to the attention of our group. Reflecting back in 2002, we had a coronavirus called SARS that led to a case fatality rate, as we say, or about 10% of people who acquired that infection die. And then MERS evolved in 2012, which was another coronavirus. And throughout this winter season now, we monitor viruses, and there's actually 4 seasonal coronaviruses. So this was identified as the 7th coronavirus that can afflict humans. And so we initiated our preparedness, anticipating and hoping that this was not going to become a major pandemic. And as you know, last week, it became a pandemic. So when this 36-year-old woman had presented to the emergency department, this was on around the 5th of March, the ER doctor called me, and here was a young woman, although she had multiple underlying conditions, medical conditions, which has been reflected in the Omaha World Herald, her father even giving interviews. So she had been visiting emergency rooms multiple occasions before that visit with migraine headache issues. And now here she presents with acute hypoxemic respiratory failure, shortness of breath, difficulty breathing, fever, and a dry cough.
Yeah.
And as we now have learned, that is a characteristic presentation for COVID-19, the disease, as we're referring to it. So dry cough, fever, shortness of breath. And we, at that point in time, she had traveled from London, had arrived back here about a week before, and she did not really fulfill criteria for screening for COVID-19 at that point in time. But in talking to the ED doc, we recommended getting a CAT scan of the chest, because the chest x-ray was pretty unremarkable, but the CAT scan showed very characteristic bilateral, what we call pulmonary infiltrates, kind of ground glass infiltrates, very consistent with COVID-19. And after she had arrived, an abundance of precautions were taken that we had prepared for this possibility with training our healthcare workers what is optimal personal protective equipment, which includes, mask, special mask, eye protection, gowns, gloves. And so she was transferred to our main campus here, and then eventually had to be transferred to Nebraska Medicine because she had ongoing and progressive acute hypoxemic respiratory failure. So the first patient we saw then was a good example of the severity of this disease. Now, reassuringly, the majority of people who get this are not going to have that severe spectrum, and it's been estimated that about 20% of people will remain asymptomatic, and especially children seem to be spared from this. And we're still trying to work out the risk in pregnancy. As you know, there's no vertical transmission that's been documented in very short publications so far. About 80% of people will have a mild type of presentation. And for example, I know one patient out in the community just had sore throat. So, but it's fever, cough, dry cough, and shortness of breath that we're especially concerned about. But you can present with minor symptoms like sore throat, myalgias, just that generalized malaise or feeling terrible, feeling to go to bed, feeling like you see in flu. And we should also emphasize that maybe 5 to 10% of patients may be presenting with GI symptomatology like nausea, vomiting, diarrhea, and even abdominal pain. So it's not a common presentation, but we have a lower threshold for looking at that presentation as well as possibly representing COVID-19 now.
Yeah, and I think this is one of the take-home points for people. You know, we said fever, dry cough, you know, shortness of breath seem to be the major symptoms that we're really looking for when we're screening as healthcare providers, but there are these other big symptoms that Dr. Penn's talking about, and I think that is the fear in the community is we have asymptomatic spread that's happening. And so when we think about, you know, now calling this a pandemic and what the burden is going to be on our healthcare system, I think that's what puts, you know, a lot of people in fear. I know the University of Nebraska Medical Center, we have a biocontainment unit here that Dr. Penn referenced. Our first patient here in Nebraska went to that unit, and they did a press conference yesterday talking about the possibility of what this may look like in the coming weeks. And I've heard a lot of numbers thrown around as far as 30 to 40% of people will likely obtain COVID-19 at some point, upwards. I've even heard estimates of 70%. Do you think the social distancing that we've put in place is going to help slow that spread? What should people hear right now?
Well, finishing at the clinical spectrum, about 15%, so 80% mild disease, 15% may have more moderately severe, but will recover, and it's that 5% that we're especially concerned about that are developing severe to critical illness that will definitely need to be hospitalized, potentially put on a ventilator. Mm-hmm. So I think when it comes to prevention, we're at, first of all, think about yourself. You've got to think about your own health. And that includes good hand hygiene, frequent hand hygiene, not touching your face. And these are the CDC guidelines, the standard guidelines. So hand hygiene, 20 minutes of soap and water, making sure you get back of
20
hands,
seconds, but 20 minutes is good too.
Oh, 20 seconds, sorry. Yes, 20 seconds. So front of hands, back of hands, fingernails, thumb, or if you're doing alcohol hand hygiene, ideally also for 20 seconds.
Yeah.
And they say, well, sing the happy birthday song twice. So it starts with you're protecting yourself, good hand hygiene, you know, not touching your face, unless if you do hand hygiene, of course, then if you need to. So if you got an itch, you know, do your hand hygiene and then you can touch your face. And then the concept of social distancing, and this, we have to reflect back on what we call the epidemiology, the virology of these coronaviruses, that at this point in time, we feel these are primarily transmitted by close contact, being within 6 feet of somebody. And you know, one problem is if you cough, or especially if you sneeze, and I show this slide of projecting over 4,000 droplets up to 6 feet. So it's kind of arbitrary, but that's where we get this 6 feet, or potentially any infectious secretions. And I was reading a paper this morning that hasn't been published or peer-reviewed yet, but it seemed to be a reputable paper. You know, the question is, how long does this virus live in the environment?
Right.
And we know it can live potentially hours to days, and in fact on plastic and steel, they could confirm that it lived for 2 to 3 days.
72 hours, yeah. Read the same paper, which is, I mean, 72 hours is a long time. And then I think a lot of people got fearful in the same paper. They talked about aerosolization for up to 3 hours. I mean, does that mean that somebody could just walk into the same room and breathe it in?
Yes, yeah, that 3 hour, and as I was talking to our incident command center this morning, and we've had this incident command center set up now for some time, that you've got to consider, like in this room we're in, what's the ventilation, the turnover time, and I can tell you, we're looking at the whole hospital system, because like in a CT scan area, there's one area that turns over 6 times an hour, and we have this chart. We look, so if a patient is in there with suspected COVID-19 or laboratory confirmed, We need to wait 46 minutes then before we can put another patient in that room.
Wow.
We've got to allow
Yeah.
turnover. So that versus our interventional radiology room, it turns over 16 times in that hour. So we can reduce down that time. So you're right, it could, based on that research, 3 hours suspended. And then we're talking about smaller droplet nuclei. When we're talking about 6 feet, we're talking about droplets that are 5 microns or greater in size. And viruses, of course, much smaller than that. But in general, those larger droplets are in that, and so they'll fall down. But then the smaller droplet nuclei, which are less than 5 microns, that's what they're talking about, this 3 hour. You can get these smaller droplet nuclei that stay in the air for a more suspended period of time. So you have to be careful about the environment these patients are in, looking at the ventilation and so on. And so the social distancing, again, primarily avoiding, especially anybody that's sick, within 6 feet. And now we get into what's going on around the world. And based on what we've learned from China and especially Italy, in epidemiology, we have what's called an epi curve. We look at the number of cases over a period of time. And in Italy, as you know, that curve really peaked up. Yeah, it was huge. It was a 14er in terms of,
Right.
And what we've been trying to do since the first patient we identify, isolate, then contact tracing, get into mitigation, management of the patient, that we worked with the health department, and we were early enough in what we call the containment phase that we ended up having to self-quarantine a number of healthcare workers who had that close contact by definition, because we wanted to slow down the spread of this infection. In other words, try to contain it so we could flatten out that epi curve, flatten it out, and delay the spread so we would have more time for preparation. Hopefully the research going on with antivirals would become more and more available.
Right.
We won't have a vaccine, we know, for probably greater than a year, but try to delay and spread out that epi curve. So all the canceling of schools, of mass gatherings are extremely important, I think, now for being proactive. You know, there's always an extreme. There's those that just shut themselves in, panicking, which we don't want people to panic. We want them to be informed, educated, and prepare. Have, you know, a 14-day supply, like it's going to be a bad blizzard coming. So, you know, be prepared. Be very proactive, as we say, rather than reactive. And then there's those individuals out there just kind of going about their business, but that's when it becomes important not only to think of yourself, and we can come back and talk about lifestyle and nutrition, how important that is when it comes to yourself, but think about others and what you can do to protect others. If you're getting sick, you should stay home, call in to work, especially if you've got that dry cough, fever, and monitor yourself for more serious disease, like you're getting short of breath, difficulty breathing. That's when you really need to call your primary care physician.
Yeah, I think that's a super important point, is that if you have a fever, a dry cough, shortness of breath, you should call your healthcare provider and ask what the protocol is as far as where do I present, should I be tested? Because the last thing we want is people running into the clinics and hospitals and further exposing people. And that's important in the pregnant, population. Dr. Penn mentioned we haven't seen, transmission in pregnancy, but certainly women who get pregnant are at a higher risk of respiratory complications. So you should call your doctor's office and ask where you are to present or be screened, or if you should be tested, because really, if you don't have severe symptoms, you should stay home and quarantine yourself unless things decompensate.
Yeah, precisely. And you should call your primary care physician, because throughout the city now, we've set up testing sites. So you call, there's a triage, for example, for the Methodist Health System, we have a hotline. If they call the office, they're given that hotline number, they call that, and then we have a triage system that, yes, they're screening positive, they need to be tested, and we send them to our test site, which is not in the hospital here now.
Correct.
Temporarily, we even had a tent, as you've seen.
Yes.
Nebraska even made the news.
Yes.
It's one of the areas that we're putting up tents for testing. So
And now it's snowed outside.
yeah, the weather changed. The weather changed. So.
Yeah. So I think that, I think what's scary for a lot of people is the economic burden that's going to happen. But I think that what Dr. Penn is talking about is important, is that we can slow the progression of COVID-19 through our community. I know some of the estimates coming out, of UNMC yesterday, with a possible 30 to 40% incidence in the population, would translate to, 550 to 750,000 Nebraskans who contract COVID-19, and looking at about a 0.5% mortality rate. I mean, we're still talking anywhere from 3,000 to 7,000 people that could possibly die in Nebraska alone from COVID-19. And so, I mean, those are sobering numbers. The problem, I think, too, is, and you might be able to reflect on this more, is the healthcare system isn't set up for these type of numbers. It appears that this is probably going to be a 2-month wave of illness that happens that could peak at maybe week 3, week 4, and that's when healthcare resources could feel the most burden, I think.
Yeah, precisely, and that's what we're having to prepare for, these various scenarios, because we could have a surge that would go beyond our ability to manage with our standard practices here. So we're having to step out, and look through various scenarios, making sure, number one, we want to protect our healthcare workers, keep them safe. In fact, because if all of a sudden we're having all these healthcare workers that can't come in because they're self-quarantined or sick, Jamie, then we're going to be stretched thin. So we've got to look out to keep our healthcare workers safe, uninfected, and then, of course, along with that, providing optimal care to our patients, identifying what their sickness is, isolating as appropriate, going from standard precautions to what we call transmission-based precautions. And right now we're using, again, full personal protective equipment to protect our healthcare workers.
Yeah, I think that's a great segue too, to talk about what people at home can do to help protect themselves. We talked about the social distancing, but I know Dr. Penn and I agree highly on some of the lifestyle interventions that we both use to keep ourselves in optimal condition to be doctors. First of all, to be an example to our patients, but now with COVID-19, it's super important that we're taking care of our own health. And there was a paper that came out 2018-2019 looking at influenza, and of course it was in rodents, but it was showing that the ketogenic diet or intermittent fasting or time-restricted feeding, it could be a tool to protect yourself against viral infection. Did you see this paper?
No, not that specific
Okay, I'm
one.
gonna send it to you. I'm gonna send it to you. But I think that there are lifestyle strategies that can help keep our immune system optimal, and I think diet is a huge one.
Correct.
Right,
Yeah,
that's
that's extremely important, as you well know. And I should add, you're the perfect role model, Jamie, because of how important anything you put in your mouth is going to make you healthier or sicker, because you may have to maintain a balance. And I come at this from the lens of a microbiologist. That's what led me into this area. Although as an undergraduate, I also did research in nutrition, it turned out. I looked at perinatal nutrition. And here, the weight gain of a patient and what she ate determined the IQ of her baby.
Yes.
What's this? And so all along, with a pushing of my wife, of course, Sarah, that we've always been very interested in how nutrition affects us in terms, our health, or if we get disease or not. So nutrition, lifestyle, and when it comes to nutrition, there's various ways of looking at this. I kind of like Peter Attia's perspective. First of all, look at when you eat, and then look at what you're eating, and then finally you can look at how much you're eating. So at least choose 2 of those, and ideally probably the when you're eating, the time restricted eating, and just the publication in the New England Journal, it was December the 26th, I'm sure you saw that,
Yeah.
of all the good science. And here was this researcher that said, I've done this for 20 to 30 years, and presenting all that good science, how we should be eating, a time restricted type of eating within a 6 to 8 hour period of time, and what that does in terms of clearing out these senescent cells that sit around the autophagy and so on. So think in terms of, when you eat then, and of course it's probably important not to stop eating and then go to bed 3 to 4 hours later. They say 4 hours to clear out your brain, of course.
Right.
If you got reflux problems, 3 hours. And then what you eat, as you've alluded to, and I find that sometimes patients who really focus say, yeah, I need to do that, or they'll say, there's no way I can do that. And the elephant in the room, of course, is sugar. I say, keep it simple. Just cut out the added sugar and refined carbohydrates. But as you know, we're hardwired. We're addicted to sugar.
100%. 100%. Yeah, so when you eat and what you eat are super important, especially right now in taking care of your immune system. What is it about sugar that is so bad for our bodies and our immunity in particular?
Well, the one problem with sugar, and this has been now studied multiple publications, and it's Robert Lustig. And I walked in on low carb presentations yesterday. Brenda Harris, who's probably listening to this.
Hi, Brenda.
She was watching his interview, and I just reinforced, he's a pediatric endocrinologist out of California. He can tell it like it is. And if you have any questions about why the sugar issues, you should YouTube him. He's got some great presentations. And we know what happens with sugar. You tend to have then a diet that's not very nutrient dense. So you begin starving your gut buddies, as we call them, your friendly bacteria. And it's beyond our purposes today, but your microbiome is that hidden organ that we have just discovered in the last decade. And I lecture about this, and that you have this microbiome. As you're sitting there, of course, you're only 43% human. Mm-hmm. You have 30 trillion human cells, 39 trillion bacteria, but 38 trillion of those bacteria are in your colon. So that's like a fermentation factory. And it's always releasing metabolites and determining your health, your immune balance, your hormonal balance. There's a gut-brain axis. We have bacteria that are actually ending up in our brain now. Yeah. And when it comes to COVID-19, a lecture that I had put together, but we canceled the symposium on Friday the 13th, was I was going to talk about what we now call the lung microbiome. The lung microbiome, and how that determines if you survive or don't survive, maybe from COVID-19, for example. And we're just still kind of in the solar system trying to get to Omaha, understanding all this. We're going to get to Omaha.
Yeah, I mean, I think I wrote down the mortality rates that we're seeing worldwide. If you are older than 80 years old, 15 to 20% mortality with COVID-19. If you're older than 70 to 80, 10%, 60 or older, 4%. So that the people that are 60 and older and the people with comorbidities, hypertension, diabetes, likely because they don't have good immune systems, their microbiome is not well, these are the people that are susceptible to death from COVID-19.
Yeah, because we know the diversity of your microbiome in your gut correlates with health. Yeah. And it's kind of like the nice tropical jungle. I show that slide, and then I show the next slide. It's just a devastated land, hardly anything there. And that's what happens, unfortunately, with our SAD, standard American diet.
Yeah.
It devastates. So back to the sugar, what happens is we don't have the genetic makeup to really process simple carbohydrates. It's the bacteria. We've sort of outsourced it too, but unfortunately the gang members, as we call them, are the ones that really start consuming this sugar, and they produce metabolites that aren't very healthy for us. And then our gut buddies, as we call them, kind of fade away and go in the background. And so we lose the ability of maintaining that fence, which is the mucus lining of our gut, which, if you think about it, there's 20 feet of small bowel, 4 to 5 feet of colon. And once we start losing that mucus layer, you've heard that fences make good neighbors, but that mucus keeps us away from the bacteria that could do harm. And what happens is that breaks down. We then have an inflammatory response. We get what's called leaky gut. I hate that term, but it's well documented. New England Journal 3 years ago documented the science, and you open up these gates, 70% of your immune system there, and it triggers this inflammatory response. You have bacteria then. We know when patients get critically ill, like with COVID-19, there's bacteria going from the gut to the lung, through the blood circulation, through the portal system, liver to the lung, or through the lymphatic system. That, with your surgery background, you can find bacteria in those mesenteric lymph nodes, but that lymph system carries it up to a duct up in the chest, and there's 2,000 liters of lymph fluid per 24 hours that goes through the lungs. So that's the way, if your gut's not healthy, you're gonna have what's called a dysbiosis, and that dysbiosis can end up being reflected in the lung microbiome. And we all have a normal lung microbiome, which then reflects our mouth, the oral microbiome. So again, we're back to what can you do to maintain your health? Well, start with your mouth. You got to have good oral hygiene. There's a summit going on right now on the oral hygiene. So start with the mouth, and then think in terms of eating foods that are rich in flavonoids, polyphenols, a rainbow of vegetables, healthy fats, healthy meats, and it seems that it needs to be individualized.
Yeah.
But,
nutrient-dense foods. Yeah, so healthy proteins and fats and fruits and vegetables and things like that, and avoidance of processed, ultra-processed carbs and sugars seems to be across the board, no matter what type of diet you eat, seems to be the one thing that everybody agrees on, is that it's super inflammatory and bad for our microbiome everywhere in our body.
Because if it's a processed food, as you know, 72%, at least it's got sugar, added sugar, fructose. And Robert Lustig talks about you can only metabolize fructose. That's a toxin, because it can only go to the liver, be broken down, fatty liver, triglycerides. So the importance of cutting that out. And if it's processed, also it's probably got additives, preservatives, and what we call glyphosate, which is an antibiotic. Monsanto patented that as an antibiotic in 1970s. And so those additives, preservatives, and glyphosate kill off our gut buddies again, our microbiome. So we're destroying our microbiome by eating processed foods, and also the sugar that comes with that. So it really gives us what's called a gut dysbiosis or a microbiome dysbiosis, which can then be reflected in the lung, which decreases your resilience and the ability to fight off something like COVID-19.
Yeah, so if you're listening right now and you're scared and you're worried about COVID-19, I always say control the controllables. So what you can do is you can change what you put in your mouth for the next 30 to 60 days. It does make a difference even in a short amount of time with our microbiome. I've looked at research that even 7 to 10 days we start to see things changing, within
a day or two.
Right, even quicker. So you can control what you're eating. Movement is always good, exercise is good, sleep and stress reduction are all like little pieces of the puzzle that I always talk about with patients that really do make a difference.
Yeah, all those lifestyle. Starting with sleep, make sure you're getting your sleep, and movement. You don't need to be exert yourself excessively, but basically moving, and the stress management. As you all know, that stress contributes up to 90% of the chronic diseases we're seeing. And so learning simple things like breathing. I tell patients, look at Dr. Weil's 4-7-8 breathing technique.
Right.
We can go nice YouTube, and how that resets the brain from the amygdala to the prefrontal cortex, helps you relax. And time and again, I'll have patients say, wow, that really did help me get to sleep, or that helped me relax. But then going on, mindfulness and meditation all become very important. The social interaction, but again, we're now emphasizing, the elbow bump.
Yes.
But still being able to interact with people become important, and the concerns about social distancing. We don't want people to get overly isolated. Depression and so on can follow. And all that affects your microbiome again. If you don't get enough sleep, if you're not moving, your microbiome is listening to that, and we don't really totally understand that, but you maintain a healthy, and I call it a functional core microbiome that determines your health by optimal lifestyles, healthy lifestyles. And even when I ask nurses that we coach about their nutrition, I say, what did it really take to change your nutrition and lose this 100 pounds and do like a whole 30? And she said, it was really the decision of a lifestyle change. It's not a diet. You don't count calories, but it's a lifestyle change. It's behavioral change.
Yeah. So while people are getting inspired right now listening to this to make those changes, back to COVID-19 for a second, is there anything that somebody could do as far as helping their immune system with like probiotics or zinc or anything like that in this time?
A good question, Jamie. And I've been sharing this with our hospitalists here, that the science is evolving. And I think if we look at, we talked about nutrition, how important that is, the rainbow of vegetables, the polyphenols, but I think there's some supplements that I look at as pretty critical right now. Now you can get levels checked, but you can just simply add these supplements on. The first one is vitamin D, vitamin D3.
D3 or D3 with K2, some people will take it that way too.
Yeah, the important So the combination is, vitamin D3 gets calcium in your system, but you now need vitamin K2, MK7 to get calcium into the bone
Yep.
and to get it out of the blood vessels.
Right.
And
I always give them in combo.
yeah,
so,
and there's some good combinations out there. There's one at 5,000 IU of vitamin D3 and 180 now of vitamin K2 and K7 that commonly 1 or 2 a day.
Yeah.
But again, that's been science has been there 15 years on the
Okay,
K2
so
and
vitamin D,
K7.
if you're not on it.
And ideally, you want an optimal level of 40 to 60. Now, there's certain conditions like autoimmunity or what we call immune-mediated inflammatory disease. Now, I ask patients to get more in the 70 to 100 range because vitamin D3 helps balance your immune system, both the innate and what we call the adaptive immune systems. And it's got an anti-inflammatory effect.
Yes.
So I encourage, if you haven't had a level and you're not sure where you're at, a minimum of 2,000, some are even saying up to 10,000.
Do you know what yours is right now?
Yes, I 2,000, my level was 56.
Okay, mine's 78.
So you're in the therapeutic.
Yeah.
I'm in the
Okay,
optimal.
so D3, K2, anything else that they could take to help immunity?
Yeah, so that's supporting, especially macrophages, and the macrophages are out there. In fact, there's one area of your body where macrophages are outside your body. Guess where that's at? In the lung.
Yeah.
And the lung has 600 million alveoli. And it's got a small layer of surfactant, unlike the gut that's got this thicker layer of mucus. But the lung, it's kind of like a tree upside down. You've got the larger airways, it branches out into bronchi, secondary, tertiary bronchi, and then the bronchioles, and then you get in these 600 million alveoli where you exchange gas surfactants, and there's actually little macrophages, which the vitamin D supports, out there scavenging around and saying, yeah, this shouldn't be here. And then the problem, of course, with COVID-19, and we should add, that's the name of the disease. The virus has been named SARS-CoV-2. Yeah, or covalent, but the World Health Organization is one is to use the COVID-19 as a disease. So this virus gets down into the airway, into the lung, attaches to what's called ACE2 receptor, an ACE2 receptor, just like the SARS-1 virus did. And there it triggers an inflammatory response, and I suspect those little macrophages hanging around in that surfactant then, in a sense, gobble up that and set off a danger signal, danger, and then you draw in neutrophils, monocytes are kind of the macrophage circulating in the bloodstream, and then you get this inflammatory response, you get swelling, you get fluid, and that's what patients are dying from then, is what's called an acute respiratory distress syndrome associated with that hyperimmune response. So let's say if your macrophages don't have the vitamin D, I suspect, and again, kind of maybe my opinion, they're just going to be wimpy, and they're not going to be able to do their task. And so that it's going to get overwhelmed, and then your body overcompensates. So vitamin D3, K2, and K7. The next vitamin, or mineral, we should say, is zinc. Now, we do know, and this is quickly evolving, and there's some research that's just being set up, that increased intracellular zinc has an inhibitory effect on COVID-19.
Yeah.
But how do you get increased zinc in the cell? Well, you don't want to be deficient. So I think taking some zinc every day is reasonable, just so you can be assured you're not deficient. You could get a blood level, but...
Yeah, so I do vitamin D3, K2, and I start zinc lozenges during the viral season.
Okay,
Yeah.
I've got some in my pocket right now.
You heard it, Dr. Penn and I.
Yeah, I carry it, and I intermittently suck on my zinc lozenges. And it's kind of exciting, remdesivir is an antiviral. It was used in the first patient in Seattle. But it's investigational, and down the street, Dr. Khalil has set up a randomized, double-blinded study of about 400 institutions he's trying to get involved in looking at remdesivir, that drug versus placebo. Does this really work? And there's some good science that suggests that it may, but we don't know that. Chloroquine or hydroxychloroquine. I was sitting with a patient, one of our staff yesterday, and she's on Plaquenil because of rheumatoid arthritis. And I said, there's a principle of what's called an ionophore. Ionophore, these drugs get zinc, increase zinc levels in cells, and that's the mechanism of
Interesting.
a bad drug, hydroxychloroquine. So in China now, some recent preliminary research, they're using like hydroxychloroquine, which is Plaquenil, 400 BID the first day and then 200 BID for 4 additional days. But again, it's preliminary. We don't have a good randomized controlled trial study. But to me, that's kind of exciting. How do we manipulate natural things like that? And I hesitate, but apparently there's a study that's going to be up and running looking at something natural that maybe some of your patients are already taking, that you find in a lot of foods like onions, called quercetin. Quercetin is an ionophore. And that also increases zinc. But again, we don't have any science, we don't have the randomized controlled trials. But could that also be a way of helping control infection? I should really emphasize, there's no science. I don't want people running out.
Right, but you can get these things in your diet too,
yes.
You know, so you don't have to run out and buy hundreds of dollars of supplements if you're eating, you know, a good diet, getting zinc from things like oysters and vitamin D. And what about other antioxidants like vitamin C right now? Is that helpful?
Well, you know, vitamin C has always been somewhat controversial. Personally, I take it. I take an extended release form, 1,000 twice a day during the cold season. And I also slip in a little liposomal vitamin C because you get higher levels that way. You know, Jamie, as you know, our bodies don't make vitamin C. Unlike certain animals, like the goat, will make vitamin C. And under stress, it really shoots way up, like 75 grams, the equivalent of 75 grams. So to me, it's always made sense, and we know how important vitamin C is in supporting our immune system, especially neutrophil function. That to me, this time of year, I would highly, it would, my opinion, to take it. Again, I'll be the first to admit there's been some research out there that maybe when you get what's called sepsis, life-threatening infection, there's a protocol using vitamin C and thiamine and hydrocortisone. A publication recently in JAMA suggested it did not have that much of an impact, but again, those studies are going. But so vitamin C, and take it, you know, if you can take it naturally, but don't take it in orange juice,
right?
Because of the sugar.
We made that very clear.
Yes, all right.
I mean, at the stores, right, we're hearing about the toilet paper and things like that, but I think like the Oreos and the chips have been wiped out. So that's a big take-home message. Protect yourself against disease in general. I mean, not even just COVID-19, but getting sugar and processed carbs out of your diet is super important.
Cut out the processed foods. It's so important. And unfortunately, I go to meetings now, and
what's on the table?
I know.
That's what they serve us.
It's behavioral change.
Yes. Okay, well,
So there's basically, we've kind of gone through the important list, but also this time of year, I think taking a multivitamin, primarily you get vitamin A and B6. That also supports the bone marrow, where you can generate these immune cells, your white blood cells, and emphasis on a good whole food multivitamin. I don't know if you have any preferences. To me, you almost have to order it online to get a good whole food multivitamin.
I mean, I try to get the most from my diet that I can, but our food supply also isn't what it used to be 100 years ago as far as nutrient content and things like that too. So that's the tough part. Well, I want to be respectful of Dr. Penn's time because he has a meeting that he has to get to surrounding COVID-19. So we're gonna wrap this up. Any last thoughts for people about what you're seeing, what I call on the front lines? You're like boots on the ground for COVID-19.
Well, I think what we want to be is reassuring that we're in a pandemic now. We expect a significant number of people may well get infected, but you can determine, you can control how you respond to this infection, your outcome, in other words. And the emphasis we put on, nutrition and lifestyle is just our high priorities. Consider some supplements, maybe at least vitamin D3, K2, K7, zinc, vitamin C, those. And that we are now doing all we can to prepare for increasing numbers, trying to keep that epi curve as flat as we can, protecting our healthcare workers, but also offering optimal care to our patients, identifying, do they have COVID-19 or not, managing that to the best of our ability at this point in time, and hoping we can spread this curve out and that over time it may go away. There's a seasonality component possibly to these viruses. Usually they're here from December through April or so.
When vitamin D levels are the lowest.
Yes, and that's been correlated. Is it really the bug doesn't survive in the environment or it doesn't survive in the host. And we're talking about you can determine if it survives well or not in yourself or the host by diet, nutrition, and making sure your vitamin D3 levels are optimal.
Wonderful. So take care of your metabolic health. That is the best thing that you can do to protect yourself from COVID-19 and all the other viruses that we're still seeing circulate in the community, for that matter.
Yes.
We're still seeing influenza and other respiratory viruses too.
Influenza, human metapneumovirus. Many people haven't heard from about parainfluenzas, adenovirus, rhinoviruses.
Yeah. Okay. Well, I appreciate your time, Dr. Penn. We could sit here for an hour. Maybe we'll do more of these because we have a lot that we have to talk about. But thank you guys so much for tuning in, and we'll go back and look at the questions, and we'll try to answer some of them if we can get to it. But Dr. Penn has to take care of himself because this isn't ending anytime soon. So appreciate it. Thank you guys.
Yeah. Thanks, Jamie. Okay, do we